Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Miss Davis. For questions 1 to 12, complete the notes with a word or short phrase. You now have seconds to look at the notes.
Good morning, Miss Davis. I understand you're here to discuss some facial concerns today.
Yes, that's right. It's been really worrying me for the past few weeks.
I see. Let's start from the beginning. Could you tell me when you first noticed the issue and how it has progressed?
Well, it all began about 3 weeks ago. I woke up one morning, and the left side of my face felt a little numb. I thought it was just because I'd slept in a strange position. But later that day, I realized I couldn't fully smile or blink on that side. It got worse over the next couple of days.
And this happened quite suddenly? Overnight?
Yes, pretty much. I mean, I had no prior signs or symptoms before that. It just came out of nowhere. The numbness wasn't too bad at first, but the weakness became more noticeable.
Did you experience any pain in the ear or near the jaw before the facial weakness started?
Actually, yes. A dull ache behind my left ear. I didn't think much of it at the time, but now that you mention it, that was a day or 2 before the facial weakness.
That's important to note. Pain behind the ear is often associated with facial palsy, specifically Bell's palsy, which is one of the most common causes of sudden facial paralysis.
Bell's palsy? I've heard of that, but I didn't think it could happen to me.
Yes, Bell's palsy is usually a temporary condition where the facial nerve gets inflamed, likely due to a viral infection. The good news is that most people recover fully with the right treatment. But I want to make sure we've ruled out other causes before concluding that it's Bell's palsy.
Are there other things it could be?
There are a few possibilities. Sometimes facial palsy can be linked to infections like Lyme disease, or even neurological conditions like stroke, but those would usually present with additional symptoms. Since you haven't mentioned any other issues like slurred speech or limb weakness, stroke is less likely. Still, it's important to be thorough.
No, nothing else like that. It's really just the left side of my face.
That's reassuring. Did you notice any other symptoms? For example, changes in taste, dryness in your mouth, or difficulties closing your eye on the affected side?
Actually, yes. I've noticed my left eye doesn't fully close, and it waters quite a bit. Also, food doesn't taste quite the same. It's subtle, but there's definitely a difference.
These are classic signs of Bell's palsy as well. The facial nerve controls muscles in the face, but it also has branches that affect taste and tear production, which would explain what you're experiencing. Has there been any improvement or change in the symptoms since they started?
Not really. It stayed about the same. I've been careful with my eye, using drops and trying to keep it covered at night because it doesn't close fully.
That's a good idea. Protecting the eye is important, especially if it doesn't close properly. I'll make sure you get a prescription for some protective eye ointments and additional drops. We might also suggest taping your eye closed at night to prevent it from drying out.
All right, I'll definitely do that. But how do we treat the facial palsy itself?
Treatment for Bell's palsy usually involves a course of corticosteroids. They help reduce inflammation of the facial nerve, which improves recovery outcomes. The sooner you start treatment, the better. Since you're within the 3-week window, that's encouraging.
So there's a good chance it'll get better?
Yes, the majority of patients with Bell's palsy recover fully or almost fully within 3 to 6 months. We'll also suggest some physical therapy exercises to help strengthen the muscles in your face and prevent any long-term weakness.
That's good to hear. Is there anything I should be doing in the meantime?
In addition to the medications and eye care, staying hydrated and managing stress can be helpful. There's some evidence that viral reactivations, such as herpes simplex, might trigger Bell's palsy, and stress can play a role in that.
I've been pretty stressed with work lately. Maybe that has something to do with it.
It's possible. Taking care of your overall well-being can support your recovery. If there are any signs of worsening symptoms, such as increasing weakness or additional symptoms, we'll need to investigate further.
Extract 2. Questions 13 to 24. You hear a infectious disease specialist talking to a patient called Emily. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, come on in. It's Mrs. Thompson, right?
Yes, but please, call me Emily.
Sure, Emily. So, I understand you've been referred to me because you're concerned about a salmonella infection.
Yes, I've been feeling really awful for the past few days, and my GP mentioned it could be salmonella based on my symptoms. I'm worried it might be more serious than I thought.
I understand your concern. Salmonella can be quite unpleasant, but the good news is most cases resolve without too much intervention. Let's start by going over your symptoms and when they began. Can you walk me through that?
Sure. It started about 4 days ago. I woke up in the middle of the night with horrible stomach cramps, and by the next morning I was having diarrhea and feeling really nauseous. At first, I thought it was just a stomach bug, but the symptoms didn't let up. I've also had a bit of a fever, nothing too high, just around 38 degrees Celsius.
That does sound consistent with a salmonella infection. The stomach cramps and diarrhea are classic symptoms. How has your fever been? Has it fluctuated or has it stayed at that level?
It's been fluctuating. Some parts of the day I feel like it's getting better, and then the fever comes back, along with the chills. And the diarrhea, it's been relentless. I've lost count of how many times I've been to the bathroom.
That sounds really uncomfortable. Have you been able to keep any food down, or has the nausea been too severe?
I've barely eaten anything. The thought of food makes me feel worse. I've been drinking water, but I haven't had much of an appetite. I tried eating some crackers yesterday, but they didn't sit well.
Staying hydrated is the most important thing right now. Dehydration is a common complication with salmonella infections, especially with the amount of fluid loss you've described. Have you noticed any blood in your stool?
No blood, thankfully. But my stools are really watery and I feel like I'm getting weaker by the day.
That's understandable, especially if you're not able to eat much and are losing fluids. It's good that there's no blood, though. Blood in the stool can sometimes indicate a more severe form of salmonella infection, but from what you're describing, it sounds like a typical gastrointestinal response to the bacteria.
That's a relief. But it's still pretty scary. How did I even get this? I try to be careful about food.
Salmonella is quite common and it can come from a variety of sources: undercooked poultry, raw eggs, contaminated fruits or vegetables, even cross-contamination in kitchens. Have you eaten anything recently that might have been undercooked or from a restaurant where hygiene could have been an issue?
Well, a few days before this all started, I went to a barbecue. I had some chicken that looked a little pink in the middle, but I didn't think much of it at the time. I guess that could have been it.
That's definitely a possibility. Undercooked poultry is one of the most common sources of salmonella. The bacteria thrive in raw or undercooked meat, and it can spread easily through cross-contamination if proper food handling practices aren't followed.
I had no idea it could be that dangerous. I'll definitely be more careful in the future.
It's always a good idea to make sure meat, especially poultry, is fully cooked. But don't worry, now that we have a likely source, we can focus on managing the infection. Have you been able to urinate normally, or has that changed as well?
I've noticed I'm not going as often, probably because I haven't been drinking much. I'm really trying to stay hydrated, but it feels like everything I drink just goes straight through me.
Dehydration can set in quickly with symptoms like yours, so that's something we'll need to monitor closely. If it gets worse, or if you start feeling dizzy or lightheaded, you might need 4 fluids to help replenish what you've lost. We'll make sure to check your hydration levels today.
That makes sense. I definitely feel more tired than usual, and I've been having some muscle cramps, which I guess is from being dehydrated.
Muscle cramps are a common sign of dehydration. We'll focus on getting your fluid levels up and making sure you're staying hydrated. In terms of treatment, salmonella infections generally don't require antibiotics unless the infection is severe or spreading beyond the intestines. Your immune system should be able to clear it on its own, but I'll prescribe anti-nausea medication to help you keep fluids down.
So, no antibiotics unless it gets worse? That's good to know. I've heard that too many antibiotics can cause problems.
Exactly. We try to avoid antibiotics unless absolutely necessary because overuse can lead to resistance and other complications. In most cases like yours, the body is capable of fighting the infection without them. The key is staying hydrated and managing your symptoms until your immune system clears the bacteria. Just keep sipping fluids and we'll give you something to ease the nausea. If you're able to tolerate it, you can try drinking an electrolyte solution to help replenish what you've lost.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a senior doctor giving feedback to a junior doctor after a training exercise. Now read the question.
Okay, that went quite well, didn't it? But you hesitated when it came to preparing the adrenaline dose. So what does that tell you about this scenario?
We need to make sure we're fully familiar with the medication protocols before responding.
Exactly. And of course, it takes a moment to double-check the dosage before administering it, but you have to be confident in the process. I wish there was a faster way to handle it under pressure.
Should I be the one to prepare it, or should I let someone else handle that?
It doesn't matter, as long as it's prepared correctly and promptly.
Now look at question 26. You hear a doctor and a trainee discussing treatment options for common orthopedic conditions. Now read the question.
Severity of the condition through a physical exam and possibly imaging. If the arthritis is advanced, we may consider joint replacement surgery. Otherwise, we might recommend physical therapy or arthroscopy.
Right. And what is important to explain to the patient about joint replacement surgery?
I should explain that joint replacement is often the best option when conservative treatments like medication and therapy don't help. However, they should know that recovery takes time, and physical therapy will be necessary afterward.
Exactly. And what about patients with sports injuries?
For sports injuries, we often start with rest, ice, and physical therapy. If there's significant damage, surgery such as arthroscopy may be necessary.
Now look at question 27. You hear a doctor explaining the effects of plant-based diets. Now read the question.
Thank you. So, we've been looking at the effects of plant-based diets on patients with chronic conditions, particularly diabetes. If we compare our findings to national averages, we're seeing a noticeable improvement in patient blood glucose regulation when they incorporate plant-based eating patterns. This is promising, especially considering the challenges some patients face managing their condition with medication alone. However, we've identified a challenge with sustained adherence to these dietary interventions. Many patients find it difficult to maintain these changes over time, which hinders long-term progress. Consequently, our team is now collaborating with nutrition experts to devise support mechanisms that could enhance patient commitment and help achieve lasting health improvements.
Now look at question 28. You hear a doctor discussing a patient's treatment plan with a colleague. Now read the question.
Right, so let's discuss Mr. Harris in room 5.
Okay.
He was admitted for uncontrolled diabetes. We've talked about self-management strategies, and he's been started on a new insulin regimen. So far, his blood glucose levels have been better. This morning, his fasting glucose was 110, much improved from when he arrived.
Good.
He's been given materials on managing his blood sugar and a new glucose monitor. The key thing tonight is to monitor his levels again at bedtime. We'll need to make sure he understands how to use the glucose monitor properly. So I've scheduled a nurse to check in with him at 9 to review the process.
Got it.
If his blood sugar is elevated again tonight, I'll be contacted to consider adjusting his insulin dosage.
Now look at question 29. You hear a mental health researcher giving a presentation about a study. Now read the question.
I'm a mental health researcher, and today, I'm presenting our poster about a study on mindfulness-based cognitive therapy, MBCT, for individuals suffering from moderate to severe anxiety. We conducted a case series involving 6 participants, all of whom had been referred to outpatient therapy following a diagnosis of generalized anxiety disorder. They began therapy within 2 weeks of their initial consultation and attended 8 weekly sessions. After the sessions, we followed up with each participant over the next 3 months. Our findings were that 5 out of 6 participants reported significant reductions in anxiety symptoms and an improved sense of emotional well-being. 1 participant showed minimal improvement, but she did not complete the mindfulness exercises regularly. MBCT has been widely used in depression treatment, and based on our findings, this study encourages further exploration of its use for treating anxiety in both clinical and community settings to understand its broader application.
Now look at question 30. You hear a nurse receiving feedback from her manager. Now read the question.
About the recognition you got from that patient during your shift.
I was really touched by it. It made me realize how much my actions meant to them. I guess I didn't fully appreciate the impact I had until I heard those words.
That's the beauty of meaningful recognition. It makes us more aware of the influence we have on others. But I noticed you didn't acknowledge the praise much at the time.
Yeah, I wasn't sure how to respond to something so personal.
It's understandable. But you could have responded more openly. Something simple like, "I'm glad I could help," would have been a nice way to acknowledge the patient's gratitude. Still, it's great that you're recognizing the importance of this feedback.
Thanks. I'll definitely keep that in mind for next time.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Emma Watson discussing some common myths about vaccinations. You now have 90 seconds to read questions.
My guest today is Dr. Emma Watson, a public health expert specializing in vaccination education. She's here to discuss some common myths about vaccinations and the facts behind them. Dr. Watson, why do you think so many myths still persist about vaccines?
Well, I think it's a combination of things. First, vaccines have been so effective in preventing diseases like polio, measles, and smallpox that many people don't remember how dangerous these diseases used to be. Since we don't see them as often anymore, people might question why vaccines are necessary. Second, misinformation spreads easily online, where it can be difficult to tell what's based on science and what isn't. And third, people sometimes worry about the ingredients in vaccines or potential side effects without understanding the rigorous testing and approval processes involved. This allows myths to gain traction, even when there's no evidence to support them.
Right. One of the myths we often hear is that vaccines can actually cause the diseases they're supposed to protect against. Can you explain where that comes from?
Absolutely, this is a common misunderstanding. Most vaccines contain inactivated, weakened, or small parts of the virus or bacteria, not enough to cause the disease itself. Instead, vaccines trigger the immune system to recognize and fight off the infection if the person is exposed to it later. So, no, vaccines don't cause the disease. Occasionally, people might experience mild side effects like a low-grade fever or soreness at the injection site. But this is a sign that the body is building protection, not that they're getting sick.
What about the claim that vaccines can overwhelm a child's immune system?
This is another myth. Children are exposed to many different germs and viruses every day, and their immune systems are fully capable of handling multiple vaccines at once. The immune response triggered by vaccines is tiny compared to what the body deals with on a daily basis. Modern vaccines are much more refined than they used to be, containing fewer antigens while still providing strong immunity. In short, vaccines don't overwhelm the immune system, they strengthen it by helping it recognize harmful pathogens.
Let's talk about the myth that vaccines contain harmful ingredients. This is something a lot of people are concerned about.
Yes, it's a concern that I hear frequently, but it's based on misunderstandings. Vaccine ingredients, like stabilizers or preservatives, are present in such small amounts that they are not harmful. These ingredients are carefully studied and included to ensure the vaccine remains effective and safe during storage and transport. One example people often bring up is thimerosal, a preservative that used to be in some vaccines. Despite it being removed from most vaccines years ago, the myth persists. Thimerosal was never shown to cause harm, but its removal was a precautionary measure. The truth is, vaccines are among the safest medical interventions we have.
Another myth I've heard is that natural immunity is better than vaccine-induced immunity. Is there any truth to that?
Not really. While it's true that getting infected with a disease can sometimes lead to stronger immunity, the risks associated with natural infection are much higher. For example, while measles infection can lead to lifelong immunity, it can also cause severe complications like pneumonia or encephalitis. On the other hand, vaccines offer immunity without the risk of these dangerous outcomes. It's about balancing the benefits with the risks, and vaccines are designed to provide strong protection with minimal risk.
Finally, there's this widespread belief that vaccines are linked to autism. What's the science behind that claim?
This myth has been thoroughly debunked. It stems from a now discredited study published in 1998, which falsely linked the MMR, measles, mumps, and rubella vaccine to autism. That study was retracted, and its author lost his medical license. Since then, numerous large-scale studies have shown no link between vaccines and autism. Unfortunately, this misinformation continues to circulate, leading some parents to skip vaccinations out of fear. The reality is that vaccines are safe and protect against serious diseases.
Thanks for clearing that up, Dr. Watson. It's great to hear the facts laid out so clearly.
Extract 2. Questions 37 to 42. You hear Dr. Maria Reynolds giving detailed presentation on healthcare disparities and cultural competence in nursing. Now, read the questions. You now have 90 seconds to read questions.
My name is Dr. Maria Reynolds, and today we're going to discuss an essential topic in modern healthcare, healthcare disparities, and cultural competence in nursing. We all know that patient care is complex, and numerous factors can influence its quality and outcomes. One of the key issues that often gets overlooked is the impact of language barriers. Imagine being a patient who doesn't speak the language of the healthcare provider. It's not just frustrating, it can be life-threatening. Poor communication between patients and healthcare workers leads to misunderstandings, incorrect diagnoses, and inadequate care. Addressing these barriers is crucial for ensuring all patients receive the care they deserve. Now, language barriers are just one aspect of the larger issue of healthcare disparities. For patients from minority populations, other factors like socioeconomic status, lack of access to healthcare facilities, and implicit biases also contribute to poor health outcomes. When healthcare providers lack the skills to engage with patients from diverse cultural backgrounds, it can lead to disparities in treatment. One solution? Culturally sensitive communication. Nurses, for example, must be trained to recognize and respect a patient's cultural values and beliefs, ensuring they feel understood and respected throughout their treatment. This improves not only the patient's experience, but also the overall quality of care. Culturally sensitive communication isn't just about avoiding misunderstandings, it's also about building trust. Patients who feel their cultural and language needs are understood are more likely to adhere to treatment plans and participate in their healthcare decisions. This is particularly important in minority populations, where historical and structural inequities have often resulted in a lack of trust toward healthcare providers. Unfortunately, disparities in health outcomes, such as higher rates of chronic diseases and lower life expectancy, are still prevalent in these communities. So, what can we do to combat these disparities? The key lies in cultural competence, the ability of healthcare providers to deliver services that meet the social, cultural, and linguistic needs of their patients. This isn't just a skill set, but a mindset that needs to be cultivated throughout a nurse's career. One strategy is to integrate cultural competence into nursing curricula. By embedding these principles into nursing education from the start, we can ensure that nurses are not only technically proficient, but also sensitive to the diverse needs of their patients. Let's not forget the significant role cultural competence plays in more delicate areas of healthcare, such as palliative and end-of-life care. Patients nearing the end of their lives often need a higher degree of emotional and spiritual support. Many of these needs are deeply influenced by culture. For example, different cultures have varying beliefs about pain management, family involvement in decision-making, and what constitutes a good death. Nurses who are culturally competent are better equipped to navigate these sensitive topics, providing care that is respectful, appropriate, and compassionate. Finally, we should ask ourselves, how does cultural competence affect patient satisfaction and outcomes? The answer is clear. Cultural competence leads to improved patient satisfaction, better adherence to medical advice, and overall better health outcomes. When patients feel understood, respected, and supported, their engagement with healthcare services increases, leading to faster recovery and more successful treatment outcomes. In essence, cultural competence isn't just a bonus skill for nurses, it's fundamental to improving healthcare for everyone. So to sum up, addressing healthcare disparities is critical to achieving equity in healthcare. Nurses, being on the front lines of patient care, play a pivotal role in bridging the gap through culturally sensitive communication and cultural competence. By recognizing the unique needs of minority populations and incorporating these principles into both education and practice, we can ensure a healthcare system that serves all patients effectively, regardless of their background. Thank you.
That is the end of Part C. You now have 2 minutes to check your answers.